Yes, ma'am, you can go ahead.
Ma'am, do I start? Hello?
Yeah, we can
Yeah,
hear.
please. Yeah, Didi, go ahead.
Unmute and go ahead.
Okay. Is only unmuting sufficient, or do you want me to share the video also?
Video is better.
Okay, ma'am. Okay. Good evening to IMA KSB members, MSN members, and all the enthusiasts present here. And would like to thank the KSB members for giving us this opportunity. I would like to invite Dr. V.V. Chindivalar sir, President, IMA KSB, Dr. Suriraju V. sir, Honorable Secretary, IMA KSB, Dr. Padma Prakash ma'am, Chairman, IMA MSN Subcommittee, and Dr. Vinaya Srinivas ma'am, IMA KSB Coordinator and IMA MSN Subcommittee. It's a pleasure to have all of you here, ma'am and sirs. Today, we will be discussing about the past activities of MSN and discussing future progress and program as we move on to a new session. Before we start, I would like to request Tanushri to deliver the IMA prayer. Thank you.
Good evening, everybody. I'll be delivering the IMA prayer. May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and lure.
Also flag salutation. Do it. Padma, flag salutation ಮಾಡ್ಸಿ.
Aditi?
We don't have the vaccination memo with us. So it's for the prayer which will be.
Okay, done. Go ahead. Go ahead. No
I'll do
issues.
that. No, sir. Secretary sir will do it. Secretary sir will do it.
I'll do that. ಧ್ವಜವಂದನೆ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜವನ್ನು ವಂದಿಸಲು ಇಲ್ಲಿ ನಿಂತಿದ್ದೇವೆ. ಅದರ ಗೌರವ ಮತ್ತು ವೈಭವವೇ ನಮಗೆ ಬೆಳಕು ಮತ್ತು ಶಕ್ತಿ, ಮತ್ತು ಅದರ ಪಥವೇ ನಮ್ಮ ಪಥವು. ಮಾನ್ಯತೆ ಪಡೆದಿರುವ ರಾಷ್ಟ್ರ ಸಂಸ್ಥೆಯ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ಜವಾಬ್ದಾರಿಗಳನ್ನು ಅರಿಯುವ ಮೂಲಕ ನಮ್ಮ ರಾಜನಿಷ್ಠೆಯ ಶಪಥ ಮಾಡುತ್ತಿದ್ದೇವೆ. ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜವು ಉನ್ನತ ಮಟ್ಟದಲ್ಲಿ ಹಾರಾಡುವ ಸಲುವಾಗಿ ನಮ್ಮ ಅಧಿಕಾರದಲ್ಲಿರುವ ಎಲ್ಲವನ್ನೂ ಅದಕ್ಕೆ ಸಮರ್ಪಿಸುವ ಪ್ರಮಾಣ ಮಾಡುತ್ತಿದ್ದೇವೆ. ಜೈ ಹಿಂದ್. IMA ಚಿರಾಯವಾಗಿರಲಿ. ವಂದನೆಗಳು.
Thank you, sir. Moving on with the event, I would like to request Dr. V.V. Chindivalar sir, President IMA KSB, to speak a few words.
Hello.
Yes, sir. Go ahead, sir.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಇಂದಿನ ಈ ಪ್ರಥಮ MSN ವರ್ಚುವಲ್ ಮೀಟಿಂಗಿಗೆ ತಮಗೆಲ್ಲರಿಗೂ ಡಾಕ್ಟರ್ ಪದ್ಮಾ ಪ್ರಕಾಶ್ ಚೇರ್ಮನ್ನು, ಕಾರ್ಯದರ್ಶಿಯಾದಂಥ ಡಾಕ್ಟರ್ ಸೂರ್ಯರಾಜು, ಡಾಕ್ಟರ್ ವಿನಯ ಶ್ರೀನಿವಾಸ್ ಕೋಆರ್ಡಿನೇಟರು, ಮತ್ತು MSN ಮೆಂಬರ್ಸ್ ಆದಂಥ ಗೌರವ್, ಅದಿತಿ, ಮತ್ತೆ ಯಾರಿದ್ದಾರೆ?
Anush.
ಸರ್ ನನ್ನನ್ನು ಬಿಟ್ಬಿಟ್ಟಿದ್ದೀರಾ?
ಅದಕ್ಕೆ ಇಲ್ಲಿ ಲೀಸ್ಟ್ ನೋಡ್ತಾ ಇದ್ದೀನಮ್ಮ. ಡಾಕ್ಟರ್ ವಿನಯ ಶ್ರೀನಿವಾಸ್, ಡಾಕ್ಟರ್ ಅನುರಾಧ ಪರಮೇಶ್, ಆಮೇಲೆ ಸ್ಟೂಡೆಂಟ್ಸ್ ಆದಂತಹ ಹೇಮಾ ರೆಡ್ಡಿ, ಐಶ್ವರ್ಯ, ಕುಶಾಲ್, ಶಿವಕುಮಾರ್, ಎಲ್ಲರಿಗೂ ನಮ್ಮ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಶಾಖೆಯ ಪರವಾಗಿ ತಮಗೆಲ್ಲರಿಗೂ ಸುಸ್ವಾಗತ. ಇಲ್ಲಿಯವರೆಗೆ ಹೋದ ವರ್ಷ MSN ಬಗ್ಗೆ ಏನೇನು ಆಗಿದ್ದು ಅದರ ಬಗ್ಗೆ ಸಂಕ್ಷಿಪ್ತವಾಗಿ ಡಾಕ್ಟರ್ ಪದ್ಮಾ ಪ್ರಕಾಶ್ ಅವರು ಹೇಳ್ತಾರೆ. ನಂತರ ಮುಂದಿನ ಈ ಒಂದು ವರ್ಷದಲ್ಲಿ ಏನೇನೋ ನಾವು ಯೋಜನೆಗಳನ್ನು ಹಾಕಿಕೊಂಡಿದ್ದ ಬಗ್ಗೆನೂ ಅವರು ಸವಿಸ್ತರವಾಗಿ ತಿಳಿಸಿಕೊಡ್ತಾರಂತ ಹೇಳಿ ನಾನು ಕೇಳಿಕೊಳ್ತಾ ಇದ್ದೇನೆ. ಪದ್ಮಾ ಪ್ರಕಾಶ್.
Thank you so much, sir.
ಹೇಳಿ.
Now I would request Padma Prakash ma'am to say a few words.
John?
Yes, ma'am.
I think I request Dr. Suri Raju to say a few words because he is the secretary. Dr.
Yeah.
Suri Raju, please go ahead. I'll do it later. After.
Good evening, everyone. Welcome to Medical Student Network. As you all are aware, Medical Student Network is subcommittee of Indian Medical Association, which was started in 2016 at headquarters and 2021 in Karnataka. Aim of Medical Student Network is to bring all the medical students across the India to one platform. Talented MBBS students will be given an opportunity to showcase their talent and to develop leadership qualities in the upcoming healthcare system. Every state has separate network in WhatsApp groups of MSN, but finally the headquarters will be monitoring all the activities. Thank you all. Welcome you.
John, will you share the slides, please?
Thank you so much, sir, for your enlightening words. Now I would request Padma ma'am, the chairman of IMA MSN subcommittee, to speak a few words.
Yeah. Thank you so much. Good evening, Dr. Chinnavelar sir, President IMA KSB, Honorary Secretary Dr. Suri Raju sir, my fellow colleague Dr. Vinaya Srinivas, she is the coordinator of IMA MSN, and Aditi, then Gaurav, I think Prasanna is here, Prasanna, and all the students who are present here, Dr. Anuradha Paramesh, Madam, she is into Central MSN committee member. So Kushal is there, Hema, Aditi, Anushri. So any left out, please excuse me. So I think this is the first meeting of MSN subcommittee of IMA KSB. So me and Dr. Vinaya, we just decided that we should start. Initially, the first meeting we thought we'll have, we'll just speak about what is MSN to attract more students to come together. So later, I think the more of the activities will be given to the students only, because it's a medical student network. We'll just guide them how to go in the path, like how they have to get organized. Because I think previous years, as Dr. Suri Raju sir is saying, in the central it started during 2016, and in Karnataka 2021. I think Dr. Madhusudan Karagnur, he was the president. So these people are doing a lot of work, especially I was just looking into the WhatsApp groups. So a lot of activities are happening. So just we want to kickstart with this activity of MSN of Karnataka branch. So we thought with this introduction, we'll give introduction so that in coming days we can guide them, or if they want any help, definitely they can take from us. So once again, with a short brief introduction, I'm starting the presentation. So MSN present and future. This is the terminology, heading given by Vinaya Prasad. Thank you so much. I think it is lovely and attractive as well. So Indian Medical Association Medical Student Network, that is IMA MSN, is the students wing of IMA. Next slide. John. John, are you here?
Yeah, 1 second.
What is the aim? As Dr. Suri Raju was saying, it is to connect the medical student from all the medical colleges in India and to provide means for curricular and extracurricular activities. So here we are mentioning curricular is whatever we study, like being to be doctors, and extracurricular activities, because we have got a lot of students who are having leadership qualities. So once we just study, become doctors, we have our own establishment. But when we think out of box, there are a lot of things, extracurricular activities. So that also we have to encourage the students to participate in the extracurricular activities also. That is the aim of having this medical student network across India. Next slide, please. So coming to the objectives, it is to sensitize the students in the Medical College of Modern Medicine, that is allopathy, about our Indian Medical Association and its activities with an aim to enroll them as a member of IMA in the future. See, once they are MSN, then they have to enroll them. The continuation will be there for them to coming to the Indian Medical Association in the future days as well, to help and guide them regarding future prospect in medical career, education, ethics, research, and employment avenues as well. To help and guide them to intervene if any problem arises during their educational career. Of the latest, you have seen Arjekar, Kolkata, a lot of issues were there. So the students, the bonding was so good that even the state and central government, and even including the judicial, they were really afraid how much strength they had, whether they went to the media, whether they were in the public, whether they with the patients. So they were very strong enough. I think this bonding of togetherness, they gave them so much of courage. So apart from this, so any problem arises during their student life or post student life during their practice, so they'll have this courage to come together and fight for the justice. And to identify, as sir was saying, to identify the talented MBBS students and give them an opportunity to showcase their talent and skills, which further help them for improvement. Because during our college days, so it used to be only inside the colleges or it used to be inside the universities. Now they have, because of the social media handles, they have a lot of opportunities. They should get connected with each other, whether it is a state, district wise or the national wise. So they've got a lot of opportunities to show their talents and to involve them in various social and cultural activities and national health programs. So you can just view them in their Twitter handles or in the Facebook. Lot of health programs they are doing, which are outreach to the public, outreach to the society. So whenever they look into these social handles, so even public will learn a lot of things, and they will know, public will understand how much the students are working hard along with their studies, how much they're contributing them their activities to the society. As medical students are future of healthcare of the society, they play a major role in constructing healthy India. This is very important because now I'll come to the next slide saying that how many medical colleges are there, were there in India, and how many now they've increased, whether inside, like, each state wise. So a lot of opportunities, lot of students, and many students are coming out every year. Like, they are doing their graduation. So prior, during their medical student life, so they are the future of the healthcare of the society. So once we train them to be the leaders, so they'll play a major role. So you can think of like 20 years or 30 years ahead, a lot of robo surgeries are happening. Today I watched a video. So they can sit in a place, a surgeon, and they can operate in a different country in a gap of 0.1 seconds. So much of we are getting advanced in technology, especially in the surgical branches. So these students will play a major role in constructing healthy India. As I told before, they can emerge as young global leaders. Forget about Karnataka, India. So now, click of the mouse, we can see America. So when they have these leadership qualities during the student life, definitely they can grow as young global leaders as well. So who can become members of IMA MSN? MBBS students from first year till end of internship can become members. No prefix with doctor. They go to Junior Doctors Association, JDL. So curious to know why to join? So many will be thinking, say, the attendance is only 20, including all the IMA KSB branch, but we expect a lot of students involvement, because only 20-30, we expected around 100 students at least, because whatever you are having your daily schedule of your practicals or theory, whatever, but still spending at least 30 to 40 minutes with the seniors, you will get exposed to a lot of experience of the seniors, which will help you in the coming days. So you will be thinking that why should I join MSN? So I've got my own commitments of studies, my personal works as well. But once you become the MSN students, you can participate in activities of Indian Medical Association, Medical Students Network, as I told earlier, to contest and vote for electing office bearers of Indian Medical Association, to attend scientific, cultural, social activities affiliating branches, whether it is state headquarter or IMA headquarter, but this will be subjected to approval of the respective body. Because once we are saying the state and the IMA, again the body will take a call. So when to attend, how to attend, the students when they can attend. Next slide. So continuation of that, you can participate in the annual general body meetings and the annual convention. Concessional registration fees to attend the local, state and IMA headquarters conferences, which is very important. Again, it is subjected to approval by the respective body. To participate in the inter-college sports and other activities. Of the latest, in the IMA KSB, I'm seeing a lot of doctors still they are active in the sports, especially cricket or tennis, swimming, athletes. So anybody who are really interested or from the childhood, if they're into the sports and all, definitely you can participate in the inter-college sports and other activities. It is a privilege to stay in the IMA houses in India as per the IMA rules. Whatever the IMA rule says, Indian Medical Association headquarters rules. So when you go into any state or the headquarters, you will have the privilege to stay there. Concessions for Indian Medical Association MSN members to become life member of IMA within 6 months of full registration with Medical Council. So this is really added advantage that within 6 months we can become the members as well also once you complete the course. So coming to the registration fees, it's very nominal. Once earlier it used to be 100 rupees per year. Now they've changed into 500 rupees one time. I think Dr. Anuradha madam will throw more light about this. But as per my knowledge goes, it's only 500 rupees one time. Headquarters and each state are having separate network with the social media handles, like I told before, like they have a lot of Facebook pages, Instagrams, where the activities are regularly getting updated. If they do activity now, I think within 24 to 40 hours, they're getting updated. So whenever you want to watch what's happening, you just can go through and you can get connected. And the activities, I was really surprised by looking at the activities. I've conducted a lot of workshops, online sessions, quiz programs, scientific sessions, and as I told, Arjakar incident, fight for justice, and the celebrate even relevant occasions also, because we need both enjoyment as well, apart from our scientific sessions. So, and they've done contributed to the society, like by health awareness programs, society reforming activities. So this is how we give back to the society. Whatever we have taken from the society, we should be very liberal to give back to the society and getting them educated by conducting all the health programs and updating them so that people, whenever they want to look what MSN of IMA is doing, so definitely you will get appreciated. So this can be viewed in the social media pages. So coming to the very interesting point, I think most of us, we are aware of this. There are 780 medical colleges in India. So 102% rise from 2013-14 when there were only 387 medical colleges. The number of MBBS seats have increased from 51,348 before 24 to 118,137 in 2024. So WHO says that the standard of doctors patient ratio should be 1:1,000, but in India we are 1:811. But the only thing is that most of the doctors were placed in 3-tier and 2-tier cities. Still, the rural people are having shortage of doctors who go and serve them. Of course, the primary health centers and taluk hospitals, district headquarters, medical colleges, and private hospital like we have Fana also. So these places we are serving the society, but still the population wise, whatever WHO says, we have already fulfilled. So I think in another 10 years, we expect India to be very, like, they'll have a full healthcare, established healthcare system in India. So states, so what about the states with highest number of MBBS seats? Are Tamil Nadu having 11,225. Of course, the population also more compared to us. Karnataka 10,145 seats. Maharashtra 9,895. Uttar Pradesh, just have taken the 4 maximum, 9,053 MBBS seats. So you can imagine how many students they come out every year graduating. So of course, there'll be students also so many. So by putting the numbers here, in the coming days, we have to, like, Karnataka MSN means we should be number 1. We should be very strong by number wise as well as activities wise. So we want like more people to getting enrolled. That is the intention. With that intention only, I've just made like how many number of MBBS seats across. In Karnataka, there are 22 government medical colleges, where 32 private medical colleges as well. So almost 54 colleges we have in Karnataka. So this is the mail ID. If you want to like have any queries, if you want to have a look at what's happening MSN headquarters, especially like, national, even they have a Twitter handle also. Whenever you find time, don't spend most of their time like, MSN, like study, because you are students, you have a lot of academic curricular activities, but at least once a week or once in 3 days, spend half an hour, keep half an hour aside, just go through what's happening and spend half an hour time once in 3 days to just motivate your friends to become members, so that over time, at least probably in another 3 to 6 months, we should have maximum number of students from Karnataka. Next slide. So we were thinking what future, okay, suppose you do join MSN, then you're coming to JD, and then you become IMA members. But in this initial stages, so advantages that you're getting connected with each other with good communication skills. You can grow together, better problem solving. You can improve your mental health because you will get connected with all the senior members. So there will be a lot of lectures. If you spend 40 minutes once a month, so a lot of things will happen. You can experience them. Please try to understand. Once you be with the seniors and all, you will know how to nurture your relationship with your friends, peers, as well as the seniors. Supporting each other during crisis. New opportunities for professional growth. Once you finish your studies, go to JDN. So once you come across with a lot of good doctors, you will have new opportunities, whether it is to study your post graduation or to establish your any establishment like hospitals, clinic, nursing homes. So coming across with a lot of people will have more opportunities, and reduce conflicts, of course, so that you can have a better understanding. And we being into allopathic doctors, as all of you are aware what's happening in and around us, so you have a sense of belonging of our doctors community. So exchange of thoughts and implement them in a better way to grow as a good leaders. I told not only Indian, you can grow as even global leaders. In the coming years, healthcare system has vast opportunities, so chance of becoming global leaders are more. Thank you. Thank you for giving this opportunity, Dr. Chinivalar sir and Dr. Suri Raju. I think Vinaya madam will update more about our activities in the coming year. And Dr. Anuradha madam also, she will throw lights. And any questions, queries, please feel free to talk to seniors. Thank you once again.
I request Dr. Anuradha Parmesh madam to throw a light on this. So regarding there is slight confusion regarding the JDN and MSN. Can you clarify the things, Doctor?
MSN is only students, sir. First year till students. Prefix, as I told, there should not be any doctor. I think doctors are after they come to house surgeon, and 10 years after house surgeoncy, like they can be assistant professors or they can be professors, tutors. So 10 years of academic, they coming to JDN. Students are only first year till final year. They are medical students.
Thank you, Dr. Padma Prakash.
Thank you, sir.
For enlightening about the MS, what is MSN, when it starts and when it ends. And today's students are the tomorrow's leaders of our IMA. So we have given what is MSN, what are their activities, everything. So now I request Dr. Anuradha Parmesh to enlighten more about this, as he is a national convener of MSN. So she will throw a little bit more lights on this MSN. Hope. To Dr. Anuradha Parmesh, madam.
Madam, unmute, madam.
Yes. Good evening, everyone. I'm on a holiday in Los Angeles, so I'm not prepared. I wanted to make sure that I'm part of the team, so that's why I'm attending. Right now, it is morning 8 o'clock for us here. And to brief everybody about MSN activity, yes, MSN is going great guns at the national level, and we also from Karnataka need to do our best for all our students. And I find that the freshers are very much interested in getting involved in all activities. Every other student wants to become an office bearer. So at the national level, I find that all other states, particularly Kerala and Tamil Nadu, they are doing extremely well. They have a very good, vibrant team, and membership is going great guns. Particularly Tamil Nadu, lot of academic activities are going on. And this time, at the state level, chairperson is Padma, Dr. Padma Prakash, and I am also a member of the MSN state branch committee, in addition to being the national standing committee member. So definitely we'll all have to delegate some medical colleges to each one of us and take it forward. I'm also part of the Karnataka State JDN team subcommittee, as well as part of MSN subcommittee, because while working at the national level as MSN's standing committee member, I realized that there is a lot of overlap with both the MSN membership as well as JDN membership. JDN, there is a lot of confusion, but with respect to MSN, we don't have any confusion. We have a link online. Our students have to log in, pay 500 rupees and become member. They can also get their ID card. So I request each one of our office bearers to utilize this opportunity and make sure that they pass on this message to the respective uh, friends in their medical colleges. And in particular, Dr. Padma, what I need to tell is these MSN membership in Karnataka has been just double digit. At least by next month, we'll see to it that all of us will take active part and see that more of them get involved in this activity. And what I expect of the MSN committee, office bearers, students is, what do you want? What is your priority? Of course, academically, as well as for mental health, those two issues we know for sure that we need to concentrate. Other activities, in particular, what you want, we will concentrate and we will take it forward. Anything else you want me to say, sir?
A library facility we are giving to the students. Please enlighten.
Students.
That's what I think. In an interaction, we can ask them. They can have an open discussion. What are their expectations from us, from IMA, or from President, Secretary, or any of the team members? So I think
Dr. Vinaya Srinivas would like to speak, Madam. Vinaya Srinivas.
Good evening, sir. Good evening, respected President, sir. Good evening, respected Secretary, sir. Good evening, Anuradha ma'am, Padma Prakash ma'am, and all the students who are present here. I'm new to MSN branch and I'm new to IMA also. This time I'm the Secretary of local branch also. So I'm trying to take MSN, IMA, MSN also to greater heights by doing many activities. As we have two medical colleges here, one private and government medical college, I'm trying to involve the students. But whenever I try to approach them and
Which
whenever
place, Dr. Vinaya? You're from which place?
Shivamogga. Sure. They come out telling that they have exams, they have internals. Today also I try to involve them, but the majority of them told second year students they're having exams. It seems university exam. Tomorrow they have microbiology paper, and final years they said they're getting prepared for internal assessment. So I said once they finish all their internals and exams, we can have one more online session and try to involve them. Today, I just prepared, means my own thoughts and my own ideas, like what are the activities which we can do both offline and online. I just try to prepare a presentation. I'll try to share it, sir. Can you see, ma'am?
No.
John.
He needs to make you
Yes, sir.
co-host.
Ma'am, tell me.
John.
Yes, madam.
Vinay, madam.
You can share. You can share.
Help, yeah. Share ಮಾಡ ಹೆಂಗೆ ಅಂತ.
It's a PPT, just open
Yes,
it.
yes, sir. It is.
Just open it and minimize it.
Okay, sir.
Come back to Zoom.
I have minimized it. It is minimized only.
And now you come back to the Zoom app.
Okay, sir. Yes, sir.
And just click on share button, madam. Green color share button.
Okay.
Then you will see that PPT. Just click on it. Yeah, that's it. Yeah, now we can see your desktop. Just open your PPT there.
On the desktop, sir.
Yeah. Just open your PPT. Double click on. Is your PPT MSN 24-25?
Yes, sir.
Just double click on it.
On the green thing, sir.
No. On the PPT only. Now we can see your screen is shared already.
Okay.
We can see your desktop, the tiger.
Okay. Okay, I have to share this.
Just open it. Yeah. Now make it full screen. Slideshow or slideshow.
Yes, sir.
Yes, we can see that. Go ahead.
Yes, sir. So my own ideas, what are the tentative schedule for 2024-25? I just came out with this. I thought we can have some offline programs as well as online programs. So among the offline programs, I thought first we should have an inauguration of the activities in one of the branches which has a medical college. So we have to discuss and we have to come out with this inauguration program wherein we have to invite Honorable President, Honorable Secretary, Anuradha ma'am, and some of the important office bearers of IMA KSB. This has to be done in one of the branch of IMA where the medical college and the office bearers are active. Then as one of the offline program, I thought we can have quiz program both on medical as well as general knowledge. This has to be an offline program. So whichever a branch wishes to take this as an initiative can have it, or we can plan to conduct this type of quiz in all the MS and IMA wherever the medical colleges are attached. We can also have workshop on how to write publications for scientific papers, because once they finish their MBBS, they have to go for post-graduation. So some of them will find difficulty in writing the publications for scientific papers. So we can give a basic idea about that here only for the students. I thought this would be a useful session for them. And this I thought very important, especially during exams. Now, at least we have earlier when we used to study, we had 1.5 years for anatomy, physiology, biochemistry. Now it is only 8 to 9 months. They have to complete everything. They'll be under a lot of stress. So it will be always nice to have workshops or guest lectures on how to manage the stress during exam time and how to face the exam in a confident way. So this also we can have and help the students. That is what is my thought. We can also have guiding sessions on how to prepare for NEET. So we can invite some resource persons who are into it, who are well-versed or expertised in that, and we can have sessions for students. All these I thought we can have it offline, sorry. I thought before last year, I remember along with Kannada Vaidya Barahagarara Samiti, MSN, along with Kannada Vaidya Barahagarara Samiti, they had arranged workshop for improving their Kannada literature, wherein they had how to write ಕನ್ನಡದಲ್ಲಿ ಕವಿತೆಗಳನ್ನು ಹೇಗೆ ಬರೆಯೋದು, ಕಥೆಗಳನ್ನು ಹೇಗೆ ಬರೆಯೋದು, ಲೇಖನಗಳನ್ನು ಹೇಗೆ ಬರೆಯೋದು ಅಂತ ಕನ್ನಡ ವೈದ್ಯ ಬರಹಗಾರರ ಸಮಿತಿ ಮತ್ತು MSN ಡಾಕ್ಟರ್ ಮಧುಸೂದನ್ ಕಾರಿಗ್ನೂರ್ ಅವರು ಪ್ರೆಸಿಡೆಂಟ್ ಆಗಿದ್ದಾಗ this type of program I remember. So such a program may help the students to improve their Kannada writing, because when I asked some of the students to give few write-ups for our Vaidya Sampada magazine, there's 2 of the students have given their write-up. They're really very nice. Only thing is they need some fine-tuning. So I thought these type of workshops may help them to improve their Kannada. And coming to the online programs, we can definitely have medical crossword puzzle we can have just to have a refreshment and have a type of outbreaking our knowledge. And we can also have poem recitation both Kannada and English we can have. We can have book reviews. These we can do online only. Only thing is we have to give the instructions well in advance and tell them to prepare, and then we can proceed with this. And as last year they have done a lot of case presentations and discussions, this will be a very beautiful platform for all the students of all over Karnataka to have case presentations and discussions. This will definitely help them to improve their clinical knowledge and different types of clinical presentations. All these students can get an exposure. And we can also have, for a change, a good cinema review online. That is what is my personal thought. So these type of things we can take up online. And as I told you, some of the things we can take up offline also. So these are my personal ideas. If seniors can tell any other ideas or any other programs which can be included, I'm with a book and paper, I'll just note down. And if students are, if they come out with their own ideas, their own interest of areas where they can have such activities, that also we are ready to take up. So this is a small presentation I did just to.
Thank you so much, Padma ma'am, Anuradha ma'am, and Vinaya ma'am for giving us such a beautiful insight into MSN and the future activities. Now I would like to open the space for any suggestions or any discussion or any question answers. Thank you.
Hello, Dr. Vinaya madam, you have
Yes,
got
sir.
a very good ideas you have put forth in front of everyone. So especially case presentations and discussions are very much important for the exam going students, especially final year. So 2 years back it was taken up. So that can be continued once again with the Padma Prakash, just because you are in a college. So you can have a good professors, examiners, and from the medical colleges, you can choose the students. So let them present an online case presentation during discussions. It's a very good idea, Dr. Vinaya Srinivas, madam.
Okay.
So hats off to you and your ideas. From the student side, so just Dr. Rajendra Prasad is there. Dr. Rajendra Prasad is also there. Just you
yes,
want
sir.
to add anything?
Yes, sir. First of all, I want to congratulate all the medical students network and the junior doctors, and they have done a tremendous job in getting justice to Abhaya, without whose effort it would not have been possible. And it has given a good strength to the medical fraternity. After that, Supreme Court has given unlimited time for the IMA advocates to speak. We should remember that earlier there were 24 adjournments Supreme Court gave when we went to the Supreme Court on violence against doctors. Now they have listened patiently. It is all, the credit should go to the junior doctors and the medical students of Kolkata. And of course, meanwhile, it so happened that the task force gave a adverse recommendation. Whatever it is, we are seeing good future, and someday the central government will come out with a very strong rules and the security for the doctors. And so also now the harassment of the junior doctors has come down, and they have fixed the number of hours. Earlier, we have seen in Bangalore only that OBG PGs were asked to do a duty of 36 hours. Now that is all taken off. And I was told that in the curriculum, the communication skill and taking the consent is included, but I found out it is not. So whoever is the doctors nearby to the medical colleges should go and teach take some hours of teaching to the final year students on communication skill and taking the consent. Because when we expect something from them, we have got to go give something to the students. Thank you, sir. Thank you very much. You are muted, sir. President, sir, you are muted.
From the students' side, anybody wants to add anything?
Good evening, sir. Sir, I'm Aditi talking from the MSN point of view, sir. Sir, can you hear me?
Yeah.
Okay. Yes, ma'am. Ma'am, from the students' point of view, we would like to have, like as you already mentioned, case presentations and quizzes, and maybe like we recently had a pediatric neonatology quiz held last month in, like along with collaboration with Marrow, and that proved to be successful. So we would love to have more such quizzes and opportunities for all of us. And ma'am, we would love to have debates or more of these kind of competitions which will help us improve on our communication skills and improve on our presentation skills. So, and ma'am, anything like a public community approach kind of a thing for any awareness program, etc., might also be very helpful. Like how recently, I think in Chitradurga College, there was a awareness program on HPV vaccination, which was conducted by IMA MSN students. So any opportunities to do such kind of an awareness programs, etc., will be very helpful. And we would love to even have clinical case presentations to ENT and OPTHAL, like how it was done for the main fourth year subjects like medicine, OBG, pediatrics before. Yes, ma'am. That's, I feel, what we want from MSN.
Okay. Madam Padma Prakash.
Yes, very good. Like, she's got very good thought process, sir, because she's telling we were earlier doing for only OBG, medicine and surgery and pediatrics, I think. Now they want even case presentation for ENT after because exam going, they can get better exposure. Number two, the public health programs, wherever they are there, I think we can inform the IMA, KSP, we can inform that so that they can come and get involved with us, sir. Suppose we are doing in Yelahanka, so the students who are interested, who are quite free, they can join from Akash Medical College, Nandi or Ambedkar. They can come and join us so that in health programs or health checkups, so they can definitely join us, sir. We'll be in touch with them. And debates, we really, I think Vinaya madam should tell debates like how to arrange. It has to be in the like in inter-college debates and something like that. It has to be, right, madam?
Yes, madam.
So I think that
So
will plan.
apart from this, apart from the studies, that is whether general medicine, surgery or thing. So we should teach the communication and counseling.
True, sir.
Because this we are not studied during our time also in community and studies. They have not taught us about how to communicate with the patient, how to counsel the patients. This is the big drawback for the students who come out, MBBS students or PG students. When they come to the practical idea, at that time it is very difficult for them to communicate with the patients as well as how to counsel the patients and attenders. So regarding this one, just you think of and have a one online this one also.
Communication skills. Yes.
Communication and skills regarding this one. What do you say, Surya Raju?
I totally agree with our president, sir. I think another important thing I would like to bring here, the Calcutta incident has really highlighted how important it is for IMA, JDN and MSN to stick together. It is very crucial to highlight issues of violence against the doctors and students to the IMA and young medical professionals. And Junior Doctors Association and Medical Student Network, you should realize it is an awesome place to boost our understanding of importance of IMA and its role. I think all of us should get together and join together for protecting ourselves, I feel, sir, same time. As you told, sir, one skills, communication skills, at the same time, self-protection, getting together. That is also equally important, I feel, sir. Thank you, sir.
Anybody wants to add anything?
Sir, can I add a few points? Yes, sir. A very good evening to everyone. This is Gaurav Jaydev, final year medical student, and the co-convener for the IMA Msn session for this academic year, sir. Welcome to everyone. So, like how my colleague Aditi mentioned, that we had an online quiz this time, and we had a very good footfall of around 400 participants. I think that was the highest among any quizzes done across all MSNs across all the states of Karnataka. So now, sir, we thought that we need to push in for more events offline as well, because I feel that when it's face to face and we do events like the rallies conducted in our college for HPV vaccination for antimicrobial awareness, I feel, sir, we need a more engaging audience online. And for that, sir, we request the KSB president and the KSB members if they could allocate us with help or in terms of funding and in terms of members, so that we can actually put forward and translate a work from the MSNN through the help of funding. So if that would be done, that would be really very helpful, sir, because we're very passionate and enthusiastic juniors as well. Plus, we have a very good registrations in MSN this year, so we can continue the events.
Sir, my suggestions I would like to give, sir.
Yes, madam.
Academically, I think Padma, you can start off with these three important topics. Chiniwala sir mentioned about communication and counseling. So, and the third one which needs to be included is mental health. And I don't believe in elaborate case presentation, elaborate talks on communication, counseling, and all that. So I think briefly you can get stalwarts to speak about each topic, say for just 15 minutes or 20 minutes, and the rest of it is open. We will allow the students to ask questions and interact. So this month we'll have on communication, next month we'll have on counseling, another month we'll have on mental health. Just I feel this should be a beginning. And simultaneously, Gaurav is mentioning about funding. So first, the foremost what KFB expects is what is the number, what is the input that we are getting, and for what we need. So you need to jot out and tell clearly to the committee and KSB as to what exactly, where exactly we fall short of funds. And online program, Padma, I think we can kickstart. Make sure that we have 2 webinars every month. One is an interaction like this. Another one would be to have an academic session, as Dr. Vinaya nicely put it, with respect to Kannada writing. We can get the team from Karnataka Kannada Barara Sangha to speak, so that there are a lot of budding writers amongst us. So we need to make a beginning by getting to know each other much better, and simultaneously work out on getting our funds stronger by getting more of membership done. So that is my suggestion, sir. Thank you.
Well taken, madam. Thank you.
Yes.
Shall we conclude the session, sir? President, sir? Aditi and Gaurav?
Only one sentence I have to say. Next week, same time, with the same ID and password, we have got a meeting on documentation and medical negligence cases by Dr. Shiv Kumar Kumbar. And so also IMA Karnataka Professional Protection Scheme, Need of the Hour by Dr. Madhusudan Karaganur. I request all the MSN students also to join the meeting. Thank you.
Thank you, sir. Aditi and Gaurav, shall we conclude the session? Without a time?
Every Tuesday.
Thank you.
Every Tuesday and Friday, it is meant for the 9 to 10. 9 to 10 is meant for the subcommittees, this one. So on alternate basis, you will have it. Just you can have a contact with John, and he will let you know. He will let you know we will be having next day. So next 17th, I think Dr. Rajendra Prasad has told about the harassment and other professional protection scheme. So we shall join that one. On Friday, there is one. I don't know. Dr. Mr. John is.
Yes, sir. That is focus editorial, sir, and anti.
Focus. Yeah. Okay. So if everything is okay, then you can conclude. Padma Prakash.
Yes, sir.
Vote of thanks.
Students only, sir. Today we are giving program to them.
Okay. Thank you so much, President Sir and Padma ma'am. Now I would like to request Tanushri to deliver the vote of thanks.
Good evening, respected office bearers and fellow members of the MSN. It gives me great joy to be able to deliver the vote of thanks after this very insightful meeting. It has been an enriching experience, and it is my honor to express our sincere thanks to all those who have contributed to making this event a grand success. First and foremost, I would like to extend a heartfelt thank you to Dr. V.V. Chinivalar, Dr. Suriraju, Dr. Padma Prakash, and Dr. Vinaya Srinivas, whose vision and hard work made today possible. Without their dedication, planning, and relentless efforts, none of this would have come to fruition. Your insightful words have truly inspired us all, and your presence has added great value to this event. We are fortunate to have had the opportunity to hear from you. We are certain that everyone has walked away with something meaningful today. To all the attendees, thank you for being here and showing your support. Your participation has made this event even more special. We hope that you leave with new knowledge, perspectives, and connections that will stay with you long after this meeting is over. A big thank you to the organizing committee, volunteers, and everyone who worked behind the scenes. Your hard work, dedication, and attention to detail have ensured that everything went smoothly, and we truly appreciate your efforts. Once again, thank you to each and every one of you for being a part of this memorable meeting. We look forward to seeing you again at future events. Wishing you all a wonderful evening ahead. Thank you.
Thank you, Tanushri.
Good night, sir.
Good night.
Thank you,
Thank you,
sir.
sir. Thank you,
Thank you,
sir.
sir. Good night.
Dr. Suriraju,
Thank you, sir. Thank you,
Anuradha
ma'am.
ma'am. Ma'am, all the students. Thank you.
Good night to everyone.
Good
Good
night.
night, sir. Good